Hi, my name is Kayla Spicer, and today I'll be performing the urinary catheter checkoff. So to begin, I will show you my badge and scan the room. Okay, to begin, I will verify the patient care order form and check the patient's wristband for 2 identifiers and compare that. So Mr. Jaguar J. Jones, date of birth August 25th, 1963, and he's allergic to penicillin. Indications for an indwelling catheter are required immobilization for surgery, strict urinary output monitoring, and to assist in the healing of open sacral or perineal wounds in incontinent patients. Okay, so I will perform hand hygiene, and I'm going to gather all of my equipment. I'll don my goggles, position my trash can, and perform hand hygiene again. I'm going to explain the procedure to my patient and lift the bed to a working height. I also want to clarify that this space is below waist level, so it would be considered a contamination, but it's all that I have to work with today. So I've raised the bed, lowered the side rail, and ensured that there's privacy for the patient. Now I'm going to position them in dorsal recumbent with legs bent and spread open. So I'm going to don my clean gloves. And at this point I would provide perineal care just by using soap and water or chlorhexidine, wipes or any of that, whatever the hospital policy is. And for female, it would be cleaning the labia furthest from you, then closest with a separate area of the cloth or a separate swab, and then another section for the innermost part. And for a male, it would be the same procedure using 3 different pieces of cloth or swabs or anything, but it would be circular motions from innermost to outermost. Okay, now I'm going to position my catheter kit in my supplies, and I'm going to open. Let me reposition you just so you can see this. Opening furthest away from me, from the sides, and closest to me. Okay, now that is open, I can use the 1-inch border to ensure that it's laying flat. And I will remove my clean gloves. Now I'm going to don my sterile gloves. I don't have much space, so I'm just going to have to do it up here and position you one more time. Okay, only touching that 1-inch border. I'm going to pick up touching the inside of the cuff for my dominant hand. Oops. Having a little bit of trouble. Uh-oh. Okay, that one's on. I can adjust in just a second. So this time I'm going to grab the outside portion underneath this cuff. Okay, now I can adjust fingers Now it's adjusted, I haven't touched the cuff portion of this, just the fingers, because I had some trouble getting those on. Now I'm going to grab the sterile field. This portion is going right up to the perineum. So the shiny side is facing down, and I will just drop that in here. It would go under the patient's legs, but since I'm using a towel, can't really do that. So just position that as close as possible and making sure it's overlapping this sterile field so that there's no open areas. So I'm going to take my tray out and prepare my lubricant. And my betadine swabs are out. I'm going to get the catheter. And I'm going to take this plastic portion off. Okay, so I'm just going to set this in the lubricant here. So for a female, it would be 1 to 2 inches that you'd want to lubricate, and for a male, 5 to 7 inches. Now that I've got that sitting in there, let me get rid of this. I'm going to take my betadine swabs and I'm going to clean the area one last time before catheter insertion. So I'm just going to use my non-dominant hand. Oh, before I do that, before I even touch the patient, let me secure the syringe to the balloon port. Okay, now I can clean my patient because this hand will be considered contaminated. So I'm going to spread the labia and clean furthest away from me, and get the second one, cleaning closest to me, and then the last one straight down the middle. Okay, now I will grab my catheter and I'm going to insert until I see urine in the tubing, and then once I see urine I will insert about 1 to 2 inches more, and now I'm going to grab that with my closest hand here, and I'm going to inflate the balloon. And I'm going to take that off, discard, and I'm going to pull back to see if it's secure, and then insert again just a little bit so there's no pressure on the neck of the bladder. Okay, now that that's in, I will secure the bag, or get this out of the kit. And I'm going to gather my stat lock device. Oops. Okay. And for this, I would place the V in here and then secure it this way. Secure it, and I would clean the patient's leg how according to hospital policy, and then apply the adhesive to the patient's leg to secure that, and then but I don't have a leg, so we're gonna use that. And then I will connect this portion to the bed frame, not the side rails, and make sure that it's lower than the bladder. Okay, and for like urine specimens, since I just inserted the catheter, I could use the bag directly. Just gonna have to pick this up for viewing purposes. So I would use this and a graduated cylinder directly under, and my specimen cup, and I would pour this, or unlock the lock device. I would open that up and go directly into the specimen cup, not contaminating it, touching any edges, and the specimen cup would be over the graduated cylinder. And then I would just once I've gotten that, lock it back into place and secure it back into the bag here. Oop. There. And this would be at the bed frame on the inside here. And I would close this and have the label on the side here. And if the catheter has been in for a while, then I would use this tubing here. We would make a little kink in the tubing like so and clamp it, and then use the drain and clean that with alcohol and let that sit for about 15 minutes for the urine to collect, and then use my 10 milliliter syringe, and I would get that out straight from the drain and then pour that into the specimen cup. And I would unclamp. Okay. Move my supplies out of the way. Okay, so to remove it, I would apply clean gloves. Before removal, I would document the insertion and the patient's reaction to the procedure, the color, consistency, anything describing the urine. And I'd also teach my patient, have the call light in reach, and teach my patient about when to use it and position them comfortably with the bed back high and the bed low, the side rails up. And then we would want to remove the catheter as soon as possible and provide daily cleaning. So for this section, I would be removing the catheter as indicated. So I'd have a little drape just so there's no water or like urine spillage on the bed. And I'll take this here, secure the syringe, or pull back 0.5 milliliter, and then let gravity pull it back up. And the water is filling back into my syringe. It's a little bit slow, so I'm going to do it myself, but you would let it do it on its own. Okay, then I would release that. And I can take the catheter out. And I would perform perineal care once again. Document the same findings: urine consistency, color, patient's reaction to the procedure, and teach my patient about UTIs and the symptoms, just because CAUTIs are very popular in the hospital and we want to prevent those. So we're going to take good care of the patient and clean the area and monitor for urination 4 to 6 hours after the removal of the catheter. And if that doesn't happen, we need to do some more assessments, and that completes my video.